So I'll be presenting on behalf of the group that met for non-pharmacological treatment of VTE. And if the members of the group are still here or managed to come, Dr. Joseph Caprini, Jim Duketis, Gino Murley, myself, Piotr Sobieschek, and Suresh Vedantham, we were very lucky to have all of these great minds working on this committee. The objectives of our group were really to address critical issues in non-pharmacological therapy for VT, including the use of compression therapy, catheter thromboembolectomy, and surgical embolectomy, to determine an area of focus in non-pharmacological therapy for NATF over the next year, and to produce enduring material that will advance the mission of NATF in the realm of non-pharmacological therapy. So with that in mind, we chose to focus on postthrombotic syndrome. Postthrombotic syndrome describes a long-term discomfort and swelling of the extremity that follows deep vein thrombosis. It's an often preventable source of substantial morbidity, including severe disability and venous ulcers. And treatment of postthrombotic syndrome places a heavy burden on patients and the healthcare system at large. Just a couple of pictures so you can understand what we're trying to work on here. Examples of the postthrombotic syndrome. Patients who've suffered deep vein thrombosis, if they develop postthrombotic syndrome, will have often hyperpigmentation of their leg or discoloration, chronic swelling and chronic discomfort. That can culminate in ulcers. In this case, the ulcers are healed, but in other cases, the ulcers do not heal and are responsible for great disability, chronic infection, and can cost thousands to millions of dollars to the healthcare system. There are unmet needs in postthrombotic syndrome. Awareness of postthrombotic syndrome as a complication of DVT is lacking among both patients and providers. And preventive measures such as compression therapy and advanced therapy for iliofemoral DVT are inconsistently utilized. And so with that, we put forward the following proposal. We'd like to draft a patient education pamphlet to increase awareness for postthrombotic syndrome and its prevention. We will record an accompanying educational video, and we will provide patients and clinicians with online access to the educational pamphlet and video and hard copies of the pamphlet. And we feel that this educational program is something that we can accomplish within the next calendar year. And so we will be working very hard as a group to get this done.